In the world of healthcare, every detail matters, especially when it comes to the usage of medical devices. One such device is the metered dose inhaler, or MDI, often used with a spacer. This humble duo plays a pivotal role in managing lung conditions such as asthma and COPD. However, its effectiveness can be compromised by incorrect usage, a problem more common than you might think. An MDI is a compact device comprising three main components: the medicine container, the mouthpiece, and its cover. The spacer, a separate component, assists in optimizing the delivery of the medication. It ensures that the medicine reaches deep into your airways, giving you the maximum benefit of your prescribed dose. Understanding the correct usage of your MDI with a spacer isn't just about following instructions, it's about safeguarding your health and ensuring the effectiveness of your treatment. The key to effective medication delivery lies in the correct usage of your MDI with a spacer. Now that we know the importance of using an MDI with a spacer correctly, let's dive into the step-by-step process. First things first, remove the mouthpiece cap from your MDI and give it a good shake. This mixes the medicine inside, ensuring that it's ready for action. Some inhalers need to be primed, so make sure to check the instructions specific to your device. Next, it's time to attach the spacer to the MDI. The spacer is a champ in making sure the medicine gets to where it needs to go. It has its own mouthpiece and cap, so everything stays clean and primed for use. Now let's get down to the brass tacks of using your MDI with a spacer. 1, stand or sit up straight. Take a deep breath in and then exhale fully. This makes room for the medicine in your lungs. 2, position the spacer's mouthpiece in your mouth, placing it between your teeth and above your tongue. Close your lips around the mouthpiece to create a tight seal. We don't want any of that precious medicine escaping, do we? 3, press down on the top of your MDI to release 1 puff of medicine into the spacer. 4, inhale slowly and deeply through the mouthpiece. If your spacer starts to whistle, that's its way of telling you to slow down. Hold your breath for about 10 seconds to let the medicine do its thing. 5, exhale slowly through your mouth. No rush here, just a calm and steady breath out. 6, if your prescribed dose requires 2 puffs, make sure to follow the instructions for the recommended wait time between puffs. Patience is key. Lastly, after using a steroid inhaler, rinse your mouth with water and spit it out. This helps prevent any potential side effects. And there you have it. By following these steps, you can ensure that your medicine reaches your airways effectively, helping you manage your lung condition. Remember, it's not just about using your MDI with a spacer, it's about using it correctly. So take the time to get it right. Your lungs will thank you. Like any other medical device, your MDI and spacer require regular cleaning and maintenance. It's essential to keep these tools in top shape, as their functionality can directly impact the effectiveness of your medication. Let's start with the MDI. It should be cleaned at least once a week. Simply remove the metal canister and rinse the plastic case and cap in warm water. Dry it thoroughly before reassembling. Do not wash the metal canister and never attempt to speed up the drying process with a heated device. As for the spacer, it should be cleaned monthly or as per manufacturer's instructions. Remove the back piece and soak both parts in warm, soapy water for about 15 minutes, then rinse and leave to air dry. Remember, you should never attempt to dry the spacer with a towel or heated device, as this can cause static electricity, which can affect the medicine distribution. Proper cleaning is just as crucial as correct usage in ensuring that your MDI with a spacer works effectively. So there you have it, the correct way to use your MDI with a spacer. I hope this guide has been helpful for you to understand the importance of proper MDI usage and maintenance. It's not just about the steps, but also about the precision and consistency. Every puff, every breath can make a world of difference in managing your lung condition. Remember, it's crucial to keep your MDI and spacer clean. This ensures the effectiveness of your medication and prevents any possible contamination. It's the small details that make a big impact, isn't it? By using your MDI with a spacer correctly and keeping it clean, you can take control of your lung condition and improve your quality of life.